Hi, everyone. I'm Dr. Nicholas Antos. I'm the director of the Cystic Fibrosis Center here in Milwaukee. I'm the director of the Pediatric CF program at Children's Wisconsin. And I have the pleasure of giving you information from our pediatric program report from the CF Foundation. Before we do that, just a little background on what this is. This is a report that we get every year from the CF Foundation. And it's really a report of the overall state of cystic fibrosis. It uses information that we put into the online CF registry, which is a large national database. And this shows both how the overall CF community is doing, but also how our CF center is doing. And it's because of this database, this registry, and these reports that we've been able to see what works well in people with cystic fibrosis, make many advances in CF, including a lot of our treatments. And so it's a very important piece. And we do also use information from this registry every time that we review the chart before we see people in clinic. And so it's a very important piece that lets us learn about CF in general and about our specific CF center. If you want to look at the overall report, it's available free online. You can go to cff.org and search for registry, or just Google CFF 2019 registry. It looks like this. I put the full link there at the bottom if people are interested. So just an idea of some of the graphs you'll be looking at. One of the charts looks like this. All these blue lines are different CF centers. The red line is us, and the green line is the national average. And depending on the measure, it may be better if we're way on the left side or way on the right side, and that may depend on what we're looking at. Another version is this one. In this type, the red line is us, and it shows kind of how things are changed over time, and the green line is the national average. And so we're going to travel back to the year 2019, which I guess wouldn't be so bad. With this, Trikafta had just been approved, so that was approved in October. This report goes until the end of January. So we had barely heard, the end of December. So we had barely heard of COVID-19 yet, and we're still really excited about the approval of Trikafta. We get our report, as I said, it is created with data up until the end of December. And then we get our report from the previous year about 6 months later, sometime in the summer or fall, okay? So I wanted to talk about some of the overall numbers. First of all, overall cystic fibrosis has continued to make amazing strides. As of this year, again, the majority of patients now are adults, so 56% of people with CF are adults, and that's been steadily going up over time. With that, more and more people are getting married, going to college, getting both bachelor's and even advanced degrees. This chart changes over 10 years, and as you can see, there's been amazing strides in the number of CF adults and young adults who are doing these things. Additionally, and this chart goes up every 5 years, there's been a bigger increase in pregnancies, and in the past 5 years especially, there is a large increase. This has also gone up even more, we think, after Trikafta, as we think it's easier for women to get pregnant now with Trikafta. We're also healthier. And so we expect this number to jump some. So definitely be sure to talk to your children and young adults about pregnancy, because again, that may be more likely, especially for the women. Gotta be more careful. And this chart is one of the most important charts. It's one that I know everybody doesn't always like to look at, but this is the median predicted survival. And what's important is a few things. One is that, as you can see, it's been steadily going up and had an even larger increase last year, as now very close to 48, so now in the upper 40s. And my favorite part of this chart actually is not the graph itself, but the paragraph underneath there in blue. And so it says that this prediction assumes no further improvement in mortality rate and thus does not take into account the potential impact of CFTR modulators and other improvements in clinical care. And so in brief, what that really means is that these numbers are on some level meaningless, as we expect that to keep skyrocketing because they have not figured out how to include modulators in this, and it doesn't include anything that we further make better over time. And so really we expect this number to keep skyrocketing and not be something that needs to be as worrisome. So for our specific CF center, we have about 151 patients at our center. We had about 7 new babies in 2019, or new diagnoses rather, and had a total of 859 encounters, and that includes clinic visits, hospitalizations, research visits, etc. And so thank you for all the time that you spend with us. We appreciate it, and it's very important both to us and to the outcomes that we'll talk about. So that's obviously a lot of times that we are with even a small number of people on some level. And so I'll jump right to the graph that many people ask us about. This is the median FEV1% predicted. So if you remember, that's the lung function number that we talk about in clinic for everybody. And for those of you who have seen me talk about this and seen our report before, we actually are a little bit lower in this chart than we were or have been sometimes. Now, overall, we are extremely good and well above the national average, but we're a little bit lower in a number than we have been at some other times. And there's a few reasons for this, and one of them has nothing to do with our center and has to do with CF in general. Now, one thing that could contribute is that we did have a few more people that were sicker than other years. So this is the percent of people that had a CF exacerbation, so a worsening of the lung disease. And still, the numbers themselves are fairly low, but we did have a little increase. So that could be part of it. But I think there's a bigger reason, and it actually has to do with the shape of this curve. And so when I started in CF many years ago, at a meeting, a very experienced CF provider came up to me and congratulated me on both joining CF, but also about our good outcomes. And he told me that everybody's going to catch up to us. And I thanked him and said that I do think that we provide great care. And he said, I have no doubt that is definitely true, but everybody is going to start rising to your level. And there's a few reasons for that. One is, of course, that just CF care improved, but there's another specific reason. And so if you look at the way this chart is now, I've drawn in here the way the chart was 5 years ago. And what he said is exactly true, is that as you can see, that curve has essentially flattened. So even just 5 years ago, there was a lot of difference between the first few centers and even just the 10th, 20th center on that graph. Whereas now there's not a whole lot of difference. And in fact, that first whole left side of the chart, that's 1 or 2 or 3 percentage points between those centers. There's not a whole lot of difference. And so there's one very specific reason for that, and a piece that you are all very familiar with, in part because of your geography. And so that's newborn screening. And so, as you may know, Wisconsin has been newborn screening one of the longest in the country, and essentially the longest. We started one of the research studies to look into newborn screening. And so Wisconsin has been newborn screening for nearly 40 years, whereas in other states, it's been only going on for about a decade or so. And so this yellow line here is the percentage of people who were diagnosed by newborn screening. As you can see, that number goes up quite a bit just 10 years ago when most of the other states joined us, whereas we've been doing it for a very long time beforehand. And so that's partly why is that now those children are all getting old enough to be on those FEV1 graphs. And essentially the rest of the country now is truly starting to catch up with us. And so we do expect that that graph, that FEV1 number, this one will plateau out and get very, very flat over time. And especially with Trikafta, it will probably get even flatter and fairly quickly so. And so that's good for the CF community overall. It means that also where we lie may not matter quite as much because everybody is getting very close in the FEV1 standpoint. With that being said, obviously our outcomes continue to be very, very good. We also have extremely good nutrition outcomes. And so this one is our percent of people with a BMI less than the 50th percentile. So for this one, we want it to be largely to the right-hand side. So lower is better because we want everybody to be above the 50th percentile. And thankfully, we are very low in the number of patients that don't reach that threshold, in large part due to the wonderful work you all do at home, but also the great work of Olivia and Tammy. Some of the other reasons for our success and your success is that you're coming to clinic. So the vast majority of people do get their 4 visits in, their culture, and their PFTs. Now, again, this was 2019, so before the pandemic. I will say when we look at these numbers for 2020, a lot of these measures and things like that are going to definitely look different and also not apply as much as they used to. We're also doing the recommended therapies. And so most people are on therapies such as Pulmazide, or alpha, and fairly early so, because we do start things like this when we start to see evidence of problems with fewer chloride channels. And this one I'm also very proud of. So remember, this is, as of the end of December, the percent of people who could get Trikafta, so those who are eligible for Trikafta, who did. And so thanks to the amazing work of Claudia, Nicole, and you guys for helping make this important for your families, insurance companies, et cetera. We had one of the highest rates of people who were supposed to be on Trikafta actually on Trikafta. So we're very successful in getting as many people as we could on that amazing medication. So I'm very proud of that. There are some areas that we could still work on. One is our oral glucose tolerance test. Our number actually overall is very good. We are well above the national average, but don't forget that this is an important test to look for CF-related diabetes, and we still could be higher to the left on this chart. Thankfully, most people do not smoke, but I will remind you again, please, if you do smoke, please stop smoking and consider trying to stop smoking, as that can worsen CF lung function. And we are higher than many other centers on the amount of smoke exposure. We also have added many team members over the years, which I think have been a great addition to our team and your care. One of them includes our CF pharmacist, Tanner. He started with us a few years ago, and in the past year or so, we've gotten a grant to help improve and make sure that he's able to see many people. And so this number has been going up steadily and is indeed above the national average. We've also started doing mental health screening, which now Don Saveco does a lot of in our clinic, assisted by Dr. Lenoble from psychology as well. And so we are above the national average for the people screened with depression. With that being said, we do want this to be as close to 100% as possible. Now, it's hard to reach everybody, but if you haven't done it, or if, for instance, you've been offered the depression screening and didn't want it done for your children, I would reconsider or think about it, because it is an important thing to do. Some of our other CF issues remain fairly low, so we have a fairly low number of patients with CF-related diabetes. And for our bacteria, there's a lot of things going on this slide, I know, but thankfully, our Pseudomonas rates have went down steadily over time and are now nicely below the national average. That's the percent of people with Pseudomonas growing from their sputum. Some other bacteria is at the national average. We did have a little increase in non-tuberculosis mycobacterium last year. And so it's still a very small number, so we're not necessarily worried about it, but it is still important that we screen for it and sometimes do treat for this bacteria as well. And lastly, for our overall treatments, we are having a similar duration of hospital stay to other centers. We've gone down a little bit and wanted to kind of plateau right where we have. Lastly, we'll leave you with our favorite chart. So this chart shows the FEV1 on the vertical axis, the up and down part, and the BMI, which is that weight, on the horizontal axis, the left to right. And really where everybody wants to be is in that very top left corner, where above where those blue lines collide. And I'm very happy to say that we are one of the few centers that is in that top box. This also shows how we've changed in 10 years, and so we've continued to make good strides, specifically in our weight, as our FEV1 was already extremely high. And so we are very proud of this. And not only, again, are we one of the few centers in that top box, we were one of the very few that were there years ago as well. And so thank you for all the amazing work that you guys do for your children. Thank you for trusting us with your CF care, and definitely thank their whole CF team for everything that we do for you and everything that they do for us as a CF center. And again, we appreciate your trust and being part of our CF family. So thank you for listening. If you have any specific questions or other things you want to hear about, please ask your CF team. And also, if you'd like, I would recommend to also view our August 2020 education night. It's available online at the link here at bit.ly/CFEd August 2024. It goes through a little bit about COVID at the time and talks a lot about what our CF team members do and what they can do for you, and has some little vignettes about that. So if you haven't viewed it yet, please go to this link. Thank you for your time, and thank you for being a part of our CF family.